Hi, good morning, and welcome to the ZP Developer Zone weekly webinar. So we like to do this weekly webinar, and it's really just answering some of the more technical or in-depth questions that have come in during the week. Let me jump straight into it because we have at least 8 questions, and I want to be kind of efficient with time. So today's the 6th of October. This is streaming live, though we always record it, so there's no big emphasis on having to come live. But if you've asked a question, hopefully we're going to cover it this week. I'm only going to read through the questions really quickly because I just want you to make sure that you do understand that your questions are probably in here and we are going to answer them in depth. So question number 1 is about whether you can use the SenseIt platform to actually develop your own solutions, your own sensors. And the quick answer is yes. It's really a potentiostat system. It can work both as a sort of product, what we call a minimally viable product. That's sort of a term from the tech industry, so you can actually go out there and start using it in the real world, or you can use it as a potentiostat. So as a potentiostat, it has all these kind of it's not menu driven, it's QR phone driven. So if you have a sort of room full of students and they've all got a smartphone, then they can use the amperometry, the open circuit potentiometry, the impedance spectroscopy, the linear sweep voltammetry, the cycle voltammetry, the square wave voltammetry to actually drive the instrument. So the quick answer to your question is yes, you really should be able to develop your own assays, your own formulations, and use it on this instrument. I'll do a little demonstration later on. Question number B is about 1B rather is can it be used for blood samples? If so, do we need the chloride resilient electrode? I'll answer this in more detail in a little bit. I just want to skim through first of all just to say I'm going to answer these questions. Can the lactate, what's the difference between Gen 1 and Gen 2 lactate sensors? I will answer that. And now the GLO, we used to do something called the glucose lactate oxygen pack. I told the team about this and they said, oh, we've discontinued it, and I think they've actually removed it from the website. And then E is we do something called the single purpose biosensor circuit. This at this moment gets programmed by us for the particular analyte that you want to use. So at this moment, if you came to us and bought some Gen 1 glucose sensors off us, we would have programmed it to detect to be used with Gen 1 glucose sensors. If you bought some Gen 1 lactate sensors off us, we would have programmed it to be used with Gen 1 lactate sensors. So yes, the answer. Question number 2, if this is your question, I'll answer it shortly. We use platinum electrodes for our glucose and lactate. It's true. I will go through this question in more detail, but I just want to say that with bovine serum albumin, that's an animal-derived product. So if you're thinking about making, let's say, wearable sensors, etc., you do not want to be using materials that are necessarily animal-derived. You can't prove. I think this all started with Creutzfeldt-Jakob's disease, which is a sort of a degenerative brain disease, unfortunately. And I think really, I just want to say good morning to Ali. Lovely to see you, Ali. So we tend not to try and use BSA, bovine serum albumin, these days in products that are wearable. And I just want to say special thanks to Ali who's come online this morning. Lovely to see you. How easy is it to use the SenseIt platform to with our screw-bridged electrodes to come up with your own assays? Super easy to be honest with you. We do have a lot of videos now. I'm delighted Ali's online this morning because I think this will be particularly pertinent to him. Now the Anna pot was an original potentiostat that we had, and we're not going to go forward with the Anna pot. We are going to go forward with the SenseIt platform. The Anna pot was a sort of, one of our sort of earlier generations, let's say, and we're definitely not going to be, so we won't be, if it's on the web stores, then the team is very slowly trying to get it off the web stores, and we'll only be going forward with the SenseIt platform from here on. So if you do find some reference to the Anna pot on our various web stores, then sorry about that, but it will be coming off it. We do have a testosterone sensor. I will be discussing that. The testosterone sensor has also been now enabled on the SenseIt platform. In fact, there's the QR code there. So testosterone is actually enabled now on the SenseIt platform. And is it possible to monitor sulfite in a continuous manner? This might be particularly interesting to Ali. We're actually just releasing a hypochlorous sensor onto the Sense It All platform, and that is used apparently, well, not apparently, in part, one of its applications is people are using things like the generation of free chlorine, which is really hypochlorous acid, to do disinfect things, but you can't just release the chlorine then back into the environment. So you can sort of, I don't want to say neutralize it, but you can chemically remove it, for example, with bisulfite. So we do have bisulfite sensors, and I will dig into that a little bit deeper. Somebody wants to make a sensor for meat pathogens. So I will discuss, I mean, I know that there's lots of pathogens associated with meat. E. coli is something that's definitely kind of interesting to the food industry, and you can definitely get E. coli antibodies, so you can make these kind of sensors, and I will discuss that. Question number 6, can you make a MIP for HIV? So HIV will have sort of proteins on its membrane, and these proteins will help it infect. So theoretically, you can make a MIP sensor, molecular imprinted polymer, for the detection of things like HIV. And I'll comment upon that, and they call out 3 proteins there. Question number 7. Somebody's interested in our glycerol sensor and our glucose sensor, and I'll talk about the IVD, and I'll also talk about a wearables potentiostat that's also coming, but it's not released yet. I will say that people say, oh, I might just hang on for that wearables potentiostat. Well, sometimes things can take a while to come out. So we will probably end up releasing the wearables potentiostat into projects with clients before you rush in and ask for a project. These are really large efforts and well-funded efforts. Question number 8, somebody's interested in sweat analysis. So they're asking what the kind of, now if somebody's at rest, I mean, the sort of scientific word is if they're sedentary, they're not really sweating. They do have something called TOOL, the total epidermis water loss. I think that might be what it stands for. Or transepidermal water loss tool. So you are perspiring, but you're necessarily sweating in the way that you imagine it, and I've done some calculations on that. Just to say that we will have a if you work for a water company, or you're interested in things like starting up companies, or you're just interested in translating electrochemical assays into point of need tests, come to the Sense It All webinar on the 22nd of October. There we'll talk about the Sense It All in much more detail. If you're interested in wearables, we'll do that on the 5th of November. We always do 2 webinars on the day because different people in different time zones. If you're in academia, interested in translation of your research into real products, then come to this webinar on the 23rd of October. And I think really that, sometimes there's a point in which, all the webinars in the world and all the online conversations in the world kind of, there's a plateauing of usefulness. So in the end, if it comes to it, then we are doing workshops on wearables and point of need testing, and this will be in Norway on the 20th and 21st of November. Now this will be very hands-on. There'll be at least 6 practicals, let's say slides, discussion, practical, slides, discussion, practical, slides, discussion, practical. So we'll do that. That'll be the format of it. And anyone who's come to our workshops know they're really hands-on. And I'll be leading that. Right. So I put these questions out here really so I can really make sure that I actually read them and try and answer them. Right. Sense It All. Does it allow for calibration using sensors we develop based on your screen printed electrodes and standard solutions we make? The entire intention of Sense It All is somebody would, for example, maybe purchase our screen printed electrodes. Now the reason I discuss this a lot more on the academic webinar, because that's like a 45-minute webinar, but I discuss it a lot. What makes the Sense It All platform work so well is actually the reproducibility of these screen printed electrodes. A lot of assays are proportional to the concentration of your analyte, which is what you want, but it's also proportional to the area of these electrodes. And what happens is there are lots of vendors out there that make electrodes, but actually the reproducibility of those electrodes is very variable, and therefore people cannot develop assays upon those screen printed electrodes because they have a signal that's proportional to the analyte, great, that's all you want. But then there's actually quite a big contribution for the variability of electrode. Now we do talk about this a lot in our webinars, but ZP, we've really worked on making our screw-bridge electrodes repeatable. So the whole intention of that Sensi-All platform is that you can develop your own assays. It's a potentiostat, so if you're developing assays, then you will use techniques like amperometry, open circuit potentiometry, impedance spectroscopy, linear sweep voltammetry, cyclic voltammetry, square wave voltammetry. It also has a data pipe built into it, and that's the difference. They're going from an electrochemical experiment to an analyte concentration. I think I may have a demo. I'll be doing a demo shortly on that. So the answer to your question is, it does allow for you to do your own assay development. Question number 2. We have a platinum 501 versus a hypervalue SPE. If you're trying to develop your own assay, I would actually suggest that the 501 was better. Why? Because it has a circular electrode, which makes it easier to pipette and functionalize onto it, because you can put a drop on there. The drop will sit on top of the circular electrode, and then, you know, with evaporation, you may end up depositing material on the surface. The fact that we can the circular electrode does allow for the dropping. And now I'm very quite keen on the rectangular electrode, but I realize that over the years people struggle to properly cover the rectangular electrode. So in the end, I think the 501 is the most appropriate for people who are doing hand pipetting and hand fabrication of their own sensors. If you're going to use and sensor in blood, you do not need the chloride resilient electrode. Why? Because the chloride in blood is generally really fixed. It's like 135 millimolar, and it's very, it's very well controlled by the body. So you do not need to use the chloride resilient electrode with blood samples. For lactate sensors, which would be easier, the platinum or gold for students making immobilized sensors? The quick answer is, it's not easy for students to make reproducible enzyme immobilizations. Every student will have a slightly different technique. When you're hand fabricating, we use robots for doing depositions. These are, $50,000 instruments, and they've really got to be maintained. So the reason I bring this up is because you've got to manage your own expectations. That student, it's not whether you use gold or platinum. Every student, when they're doing if the solution's constant and you give them a constant screen-printed electrode, every one of them doing their own deposition will end up with a slightly different, let's say, sensitivity to their sensor, because they do depositions differently. In fact, I can give you case studies of this, or at least examples. At ZP, when we're doing our workshops, everyone gets to make, for example, a glucose sensor. So they all get the same solutions, they all get the screen-printed electrodes, but everyone ends up getting actually slightly different sensitivities, because everyone is slightly, for some people it's the first time they've pipetted, for example, but even the people who are, experienced pipetting, how we will pipette is different. So it's not whether you use platinum or gold. Just understand that if you've got a room full of 20 students and they're making a glucose sensor, we've only probably about once had a failure where somebody wasn't able to make the glucose sensor using our kit, and that is over a good 100 people, let's say. So the success rate is very high, but very rarely our sensors actually give the same signal every time, because people are the irreproducibility factor in that equation. What's the difference between Gen 1 and Gen 2 sensors? I do have some slides on that, so I'll answer that. We have discontinued this GLO pack. If you find it, my apologies. The team are trying to clean it off the website. And we do have a single-purpose biosensor circuit that looks like this, and it is programmed for each particular analyte at a time. We've not tried to use our chloride sensor, so theoretically I could see the point that I'll just change screens. This is a potentiostat, but because of it's got something called a data pipe associated with it, it can turn voltammetric signals or amperometric signals or impedance spectroscopy signals actually into analyte concentrations. We haven't tried measuring chloride and sulfite in soil. people are extremely welcome to try that, but we haven't tried it. Do I think it will work? I want to be careful with that comment, because if I say yes or no, people will hold me to it. So and with science, you can only be sort of 99.999% certain. You could, until one day somebody proves you wrong, let's say. Question number one, sense it all. It is designed. I'll do a quick demonstration. So first of all, I'll just read the question, make sure I really. Is the sense it all allow us to calibrate using sensors we develop based on your screen printed electrodes and standard solutions we make? Yes, is the answer to your question. So I will do a quick demonstration on the sense it all platform. In fact, this is a good example. This is not soil, but please understand this is also not a super clean sample either. In fact, it's very bitty. If you're doing soil experiments, I got a suspicion that you will still want to. I just vortex that now, because I'm trying to homogenize it slightly. The advantages of screen printed electrodes and what we're doing is you only need very small samples. Now, when it comes to soil, I could understand that actually you're not limited by soil, but the same question, sorry, not limited by amount of material, but the same question I was also asking about blood earlier on as well. And with blood, you can't have assays that demand lots of blood. It's not. There's only a finite amount of blood that people are willing to give you. Now, this is 50 microliters that I'm about to put on this sensor. Just check that. Yeah, that's good. Now, 50 microliters is really like a drop. So this is actually quite good for blood. So the whole intention with this Sense It All platform is in fact that people will develop their own sensors. You can run this as a potentiostat, come up with your own assays, but because it has something called a data pipe associated with it, you can actually turn the raw signal into a voltammetric, into a concentration, I should say. So it's upload complete. It also said that it was too high, but let me just show you that data. So I'm just going to share my screen here. I'll just do a quick refresh on it. So this is the power seat, because every time we do an assay, the data always goes to the cloud. And then you've got a whole, you or your students have a whole suite of, let's say, tools that they can try out. God, I must have put a really crazy sample on this one. I can see here, in fact, that the way this is, I've got the cycle of voltammetry up here, and I can see here that this is, it's found the peak here. You can come in and you can come up with your own, and I'll just look at here. You can come up with your own, you can change where the peak is found, for example. You can change the formula that is used to calibrate that sensor or to convert that raw signal into a concentration. So just understand that you can develop your own assays, come up with your own calibration solutions, come up with your own calibration, come up with your own reagents, and you can use this platform to develop your own assay. And even though I did cycle voltammetry here, it's giving me, I'm not sure on the history of this sample, but it's giving me quite an interesting looking, let's say, CV. But this whole platform is designed that people can do their own work and come up with their own assays. I realize what it is. I've got some acetaminophen actually on this sensor as well. So the quick answer to your question is, it does allow you to use your own sensors and to come up with your own solutions. But of course, in the end, you do have to actually get it and start trying it out. Question number 1B. If you're going to come up with your own immobilization techniques, then I think that the 501 is better, because it's a circular electrode. It's easy to pipette onto, whereas the hypervalue one has got a rectangular electrode, so it's harder for you to get a deposition on that particular electrode. Again, if the sample's to be used with blood, you don't need the chloride resilient electrodes. I'd actually say that the chloride resilient electrodes is something that we've got on the web store, but unless I've otherwise directly instructed you, I wouldn't use them. It's only special cases that I actually recommend that people do it. The biggest issue for reproducibility with a with students will be the student themselves, especially when they're pipetting. They'll find it very hard to get reproducibility. It's probably worth saying that, one of the hardest things in terms of commercialization of electrochemical sensors is actually working on reproducibility. Question 1C, what's the difference between Gen 1 and Gen 2? We won't give away specific immobilization chemistry details. We'll tell you how to do it. We'll give you the solutions, etc. But we won't necessarily tell you. I'm not allowed to necessarily tell you the actual constituents, because I would be breaking my confidentiality. Even though I'm a founder of my own company, I would at the same time wouldn't break the confidentialities of my company. The generation 1 glucose or lactate sensor both work in the same principle, that there's an electrode. You can either buy these pre-formulated, or you can get the 501 platinum electrodes and do this yourself. But you have to do the enzyme polymer goes on the surface, then the barrier layer. You asked earlier on whether you could use BSA, bovine serum albumin. I don't think it's necessarily a good idea to be using those bovine materials in medical diagnostics. People are tending to go away from it because of the fear of infections. It's the risk in anything. You've got to somehow convince the FDA that you're not risking people. It's quite tough. So either glucose or lactate, depending on which analyte you're interested in, is reacting with its enzyme. And in the end, it's actually generating, in the case of either glucose or lactate, hydrogen peroxide. And it's the hydrogen peroxide that we're detecting on the sensor. Now, we call that a generation 1. Now, I call the next configuration a generation 2. So in a generation 2, we've actually added a catalytic layer. I'm not able to give you details on that. We have an enzyme. We have the barrier layer. And it's the same reaction. You can call this glucose or lactate. And we'll have used a corresponding enzyme. And there's a reaction really between oxygen and, in this case, glucose, mediated by the enzyme, and the oxygen is converted to hydrogen peroxide. And again, the hydrogen peroxide diffuses, but this time it doesn't react directly on the electrode. It's actually going via a catalytic center, and we get a flow of electrons. So this one is kind of essentially sometimes mediated. I can see Sue Ash is online. It's good afternoon. For me, it's 20 to 8 in the morning. But good afternoon. I realize that in India, you're 4.5 hours ahead of us. Generation 1, we detect the hydrogen peroxide directly. Generation 2, we detect the hydrogen peroxide indirectly. It allows for a slightly lower potential. Once upon a time, now I'm slightly coming off topic here, but there are 2 continuous glucose, well, no, there are 3 or 4 continuous glucose monitoring sensors on the market. One of the ones that's more famous is actually the Abbott Freestyle Libre 2. When you see people with those little discs on them, they're running what's called a Gen 2 sensor. And they would argue that their chemistry is better than a Gen 1 sensor. But I think the most accurate or clinically accurate sensor on the market at the moment is a Gen 1 sensor. It's a real debate which is actually better, Gen 1 or Gen 2, and it really depends on the application, actually, and also your ability to manufacture that sensor in a reproducible manner. So there is no better chemistry. You can have better systems, but not necessarily just a single chemistry is better than another one. Question 1, now your question 1D was regarding a GLO pack which has been discontinued. Question 1E, for each analyte, when you buy this single-purpose biosensor circuit, our guys actually look at what else you're buying so they can actually figure out how to program it. And if they can't figure out how you're going to use it, they'll contact you so that they know how to program it. But it does come programmed. This particular user was quite interested actually in measuring chloride and sulfate in soil. We have not measured chloride and sulfate in soil, but actually I did have a little go at just handling soil just this week, in fact, and I've got some videos on this. So I did, I cannot say whether we can measure chloride and sulfate in soil. I probably have a strong suspicion that, but I'm not going to say it, because if I say it, people will hold me to it. And unless I've done the work directly, then I can't absolutely say it. Somebody's just asking about CGM sensors. So the market at the moment, just this is FYI, just because this webinar's going out live, I'll also answer the question as well. Once upon a time, most diabetics were controlling their glucose using glucose strips, SMBG, self-monitoring blood glucose strips. That was a successful market for many years, and you'd have people like Abbott and Roche, really, and Johnson & Johnson, really dominating that market. Now that market became very commoditized. Now you've got lots of people doing it, and I think one of the first CGMs on the market actually came from a company called GlucoWatch, or rather, a product called GlucoWatch was made by a company called Cygnus. Now they were withdrawn from the market, but then you had somebody like Medtronic. They had something called the MiniMed, and then Dexcom, who brought CGM out. Continuous glucose monitoring has definitely proven to give better outcomes for type 1 diabetics. So CGM, continuous glucose monitoring, is definitely the way the market is now going. And Dexcom, in the last quarter of this year, they had a revenue of $1 billion. So there's definitely a very good market for CGM, continuous glucose monitoring. Why is this happening? Because you can improve the outcomes for type 1 diabetics, and now it's being approved for type 2 diabetics. And then you've got Abbott that's really pushing hard on actually the placement of their sensors into markets like wellness and sports. So you do see Olympic athletes or Olympic marathon runners are being sponsored, for example, to wear Abbott products. So yeah, CGM is definitely an upcoming technology. Companies are not struggling too much to get funded in CGM and continuous glucose monitoring. So anyway, with soil, I did do some soil tests this week. I measured out the soil. I measured out 0.1 grams of soil. I put it into one of these little Eppendorf tubes. I've probably got the sample here. In fact, I do have the sample here. I put it into one of these little Eppendorf tubes. Now with soil, because the analyte of interest might actually be in the soil, I did end up vortexing it. I was, just so I could, but actually I did end up testing this sample. And I wasn't necessarily testing it for anything super specific in that case. I was just being kind of curious more than anything. But actually, it did actually test, and I was able to use cyclovoltammetry and actually get a signal out of this. So I did actually do a little bit of a video on the soil analysis. I described how I made the sample. I described that I did 3 CVs on this, and I also described that I actually got some redox peaks out of this as well. So there's some redox activity just in soil as it stands. And I also described, I think, a little bit about how you could sort of turn that into concentrations as well. In fact, I'm describing it here. So the questioner is really wondering if they can make their own assays, and I think this video displays that actually I did a sort of spontaneous experiment, and I converted the peak height in that particular case into millimoles, because that's the power of the sensor potentiostat. The problem that we're trying to solve with this sensor potentiostat is most academic papers finish at technology readiness level number 3. It means that they finish at raw signal, and they may have even got a calibration curve. So you read the paper, you'll see raw signal, you see a calibration curve. But they can't really test products and give you, real samples and give you a concentration. But that's the bit that's different with the sensor. You can make a raw signal, you can measure something, and actually, this is really interesting actually. Ali's asking here, wouldn't the turbidity of the sample impact the result, especially when you vortex them? Honestly, Ali, I think you've got as much background as me actually in this science. The quick answer is this: if you make a sample that's, let's say, 0.1 grams, so I make a sample that's 0.1 grams, and I dilute it in 0.9 milliliters of buffer. So that's what I did in the video, because I know in the first instance I actually want the buffer to extract my analyte of interest. Now when I vortex it, my assumption is this, admittedly, that I've just, now 90% of this sample, and I say this because I'm running holding it, 90% of this sample is actually my buffer, and only 10% of it is my soil. So I'm making the intellectual argument, Ali, that in fact, most of that sample is actually my buffer. And so 90% of, let's say signal was proportional to sample type. Well, 90% of that is actually the buffer that I'm using. And then admittedly 10% it has an influence from soil. And you're arguing about turbidity. Now, the one thing about electrochemistry, obviously, as you know, because I mean, you have us back, you know, we both know that if it's an optical system, the turbidity is really sensitive to turbidity. I would actually bring up the turbidity and say to you, think about a glucose strip. It's 100% blood, and yet it's not sensitive to the red blood cells, the white blood cells, the proteins in there, everything that would constitute turbidity, let's say. And I think it's the same for this as well. Now that very quickly separates. So you could come up with a, you know, if you wanted a reduced risk, you could come up with an idea where you vortexed it. You left it for 1 minute because soil actually separated really quickly. But I can't deny that there may be some proportion of that signal, you know, which is somehow interfered by turbidity. And actually, as I was thinking aloud a little bit just now, I realized that actually you could just put it through a filter, actually. You know, one of those syringe filters. I've actually got some down here and actually get rid of that. But my quick guess is, so Ali, who's asking the question, has a very strong background in analytical chemistry. And in analytical chemistry, people are really taught to clean up the sample because they want to actually get a very accurate result in their analytical lab. Now, but I think that a lot of actually the way the world is going is people actually want accuracy. Everyone always wants accuracy. Yeah, I get it, right? They also want precision. They also want low cost. They also want speed. And they also want ease of use. So if you want accuracy, yes, you could understand that filtering, centrifuging, getting that soil sample perfect is what you want. But actually what people want is ease of use. So this was easy to prepare. They want speed. It was quick to prepare. And they actually want low cost as well. So if you can be quick, then sometimes you can also get low cost as well. Now you may trade something for accuracy, but I would argue this, that a glucose strip has an accuracy at 5 millimolar of plus or minus 15%. So when you're measuring, let's say a water sample, when you're close to the, let's say there was, you know, there was a requirement for a chlorine concentration in a particular water sample. When you're close to the, if the measurement was close to the legal limit, I could understand that accuracy is very important, because whether, you know, when your sample, there's a legal limit and your sample is coming out close to that. Accuracy is important because with a bit of accuracy, you could be over or behind the legal limit. But I suspect that in most samples, actually, your sample is well away from the legal limit. So your inaccuracy still keeps you well away from the legal limit. So I'm acknowledging your question on turbidity, and I think that I can't absolutely deny it because I've only tested one or two sample types, let's say. But of course I do test a lot of chili, and there the strategy overall is do a 1 in 10 dilution, and actually it forgives a lot of sample to sample variation. Anyway, so I thought in a lot of time just I'm going on a little bit, but the quick answer is I think doing a dilution is much more forgiving on that, let's say, turbidity problem or the sample type problem. And electrochemistry is really quite good with samples that are actually quite turbid. So I know it's a good question, and it made me sort of spend a little bit more time on that. Now, question number 2. I have kind of slightly answered this question number 2, that in fact, with question number 2, it's better to use our 501 platinum sensors. I can't reveal our formulation, and don't replace polyurethane with a animal derived material like BSA. You'll have a hell of a time with the FDA arguing that you don't cause a risk to the patient. You can definitely come up with your own assays on the SensiAll platform, and we're discontinuing the Anapot. Question number 2. we have actually put testosterone on the platform. I did some videos this week. This testosterone sensor, we've tested it at 0 picomolar testosterone, 1 picomolar, 10 picomolar, 100 picomolar, and 1 nanomolar. So we've tested it in the clinical range on testosterone. With sulfite, as I say, hypochlorous acid is used. It's used as a disinfectant in many applications, especially in the water sort of treatment industry. You can't necessarily put free chlorine or hypochlorous acid back into the environment. You can neutralize it with sulfite in a sort of dechlorination process. And we're about to release an HOCl sensor. We already have a sulfite sensor. We also have a chloride sensor as well. So we do have lots of ways of, let's say, tackling this problem. So just FYI, the SenseIt platform can do this. Now, if people want to do this this is an old slide that I've put up a lot of times, so I'll be quick about it. But the way this system works, we have sensors, we have we have the SenseIt platform. People can scan QR codes. QR codes run the meter. The meter sends the data to Julie. We can process the data and turn that back into concentration. I do lots of webinars, both on SenseIt and academic webinars on that. So I'm not going to waste your time answering that too badly or too long. If people want to do continuous measurement, it's a lot tougher. So if people want to do continuous sulfite measuring or continuous free chlorine measurements, we are capable at ZP, but I just want to say that these are not just something that you would buy off the shelf. We'd have to integrate electronics, sensors, and systems like calibration and wash solutions as well. So continuous monitoring is a lot tougher. Question number 5, somebody's interested in detecting meat pathogens. I have an old paper that shows you how to make a good immunosensor. So if you want to detect a pathogen like E. coli, then E. coli will have its own antibodies available. You can buy these online. And if you want to immobilize them, I would say follow this paper where we use, in this particular case, the hypervalue carbon electrode. Though I would actually say that maybe use the carbon 501 these days. It's easy to pipette onto. This is pyrene NHS, and then we can couple the antibody onto the surface. We actually use chitosan in this case, and I think chitosan is a shellfish derivative. So it's actually not, people used to use BSA, bovine serum albumin, quite a bit, but I think there's a movement in the market to get away from mammalian derived materials, and actually we used chitosan in this particular paper. We used cyclophotometry to show that we were actually doing the functionalization, and then we tested in this particular case by differential pulse voltammetry, though I would actually suggest that square wave voltammetry was the right way to do it these days. And square wave voltammetry is definitely one of the techniques that we have on the SenseIt platform. I would say that if people really do want us to support them in their research and through these free webinars, it does help that if they're actually using either our potentiostats and ideally our screen printed electrodes, etc., because then we can almost do the experiments ourselves. Otherwise, we're trying to support. We're trying to otherwise support other people's technologies, and then really we find out the problem is actually that technology. So now I got a nice reply on the live chat as well from Suyash about some of my answers. So no, you're very welcome. So the quick answer to how to do pathogen detection is actually, I would choose a model pathogen like E. coli. I would find a antibody that you thought was, let's say, useful enough for your application. And then I would actually use the paper that I'll link underneath this video when I've finished going live. I just want to say thank you to Chiman Fanku. I apologize for my pronunciation. But thank you for joining us live online. But yeah, you can make it basically an immunosensor for for things like E. coli. The nice thing about the SenseIt platform, super biased by the way, it does say ZP on my t-shirt and it also says ZP on the electrode. So come on, it's all. But actually what's nice about what I'm describing here is absolutely understand that if you do this assay development on this platform and you use something like square wave voltammetry, you will then be able to turn that square wave voltammetry into CFU per mil, as long as you coliform units per mil, which may be the units that you actually need to do that assay in. And you will be able to watch any of our videos on Sense It All. We can find the peak. You will have already know your calibration factor, and it will turn the peak then into a CFU per mil count, for example. So definitely try and use our technology, Sense It All platform, and obviously our screen printed electrodes, which are the 501s. Question number 6. So somebody wants to detect a virus. It's HIV in this case. They've identified some proteins. They want to use MIP technology, molecular imprinted technology. I've done quite a lot at ZP. We've definitely done a lot of MIP technology. If people come to me and say, I want to detect something, we can think about, do we use antibodies? Do we use aptamers? Do we use enzymes? Or do we use MIPS? This is a bit of a personal, I actually think that MIPS is, if I want specificity, MIPS is the last one I actually choose, to be honest with you. I haven't had, I'm very unsure about MIPS, whether you actually get specific binding or non-specific binding. So you can always get a signal off a MIP, because you'll probably end up having just what we call non-specific binding. But that means then, that other things can just as well bind to it as well. So a lesson from somebody with some experience is, be careful with MIP technology. I think it's better as a separation science, but as a detection science, I'm not absolutely convinced about it. But I can only suggest that, at least the one thing about MIPS is you can try fast. It is a quick thing to find out. I mean, literally, I could do a MIP sensor, at least make the sensor very quickly. So I would, take one of our 501 carbon electrodes. I know I'm showing one of our gold electrodes here, but carbon's just a much lower cost material. So I'd always suggest that people try carbon. I would do the electropolymerization. In fact, I would do electropolymerization in the presence of the templating molecule. I think the hardest bit is actually sometimes doing the extraction, because you actually want to leave these kind of, these holes that are meant to be specific to your analyte of interest. So you're templating. In your particular case, you identified 3 proteins. You'd have to be able to source those proteins. I haven't recommended which monomer to use, because we've done quite a lot of molecular imprinted polymer work in our time. We've used all sorts of monomers, and I can't super recommend it as a technique. What I can recommend is that it is actually fast to try, and the Sense It All platform will definitely be able to allow you to use our screen printed electrodes, and also you can often in MIPS, when I'm making a MIP or we're making a MIP, we do electropolymerization, which is really just using cyclic voltammetry, and the Sense It All platform will definitely allow you to do cyclic voltammetry. Yeah, there it is there. So I'll just go to cyclic voltammetry. Yeah, there we are. So this is in Bluetooth connection with this potentiostat, and so I'm able to sort of change the methodology that we use by using these different QR codes. So I did list out, I listed out, if we're making a biosensor, we could use enzymes, we could use aptamers, we could use antibodies, we could use MIPS. I have never recommended a MIPS to a client. I've only worked on MIPS when directed by a client, and I think they always work, but I'm always a little bit suspicious of the specificity, let's say, of them. So I haven't made lots of recommendations to you there, but that I have done is actually told you that, so for example, if you really want to have specificity, you're probably better off with viruses. Actually, we're doing with some of the viruses at the moment, we're actually doing molecular assays, which can be specific, but then you need a longer, harder workflow. If you can find a macromolecule that specifically binds to HIV, that's probably a better route to go. Question number 7, somebody's interested in glucose and glycerol. With glucose and glycerol, you can definitely use our Sense It All platform. But if you want to do wearables, now at this moment, the wearables product that we have is the single purpose biosensor circuit, We are quietly, very quietly working, quiet, if ZP can ever be quiet, and we are working on a wearable potentiostat, but it's only being released into projects at the moment. So I wouldn't wait on this. If you want to move forward and start working on wearable sensors, use our single purpose biosensor circuit. If you've got a choice in life to do let's say you had a bunch of students and you had the choice of making a continuous lactate sensor or a point of care diagnostics lactate sensor, just do point of care diagnostics work. You can learn just as much. You have a higher chance of those students being successful. Making continuous monitoring sensors is tough. That said, for some commercial reasons, people, rightly so, people want to do continuous monitoring. We are coming up with a wearable potentiostat, but just know that it's not released unless it's actually in projects, and the projects have to be quite large. Somebody was asking me actually what's the sweat rate in somebody who's really sedentary. And they also asked me what's the minimum droplet size for a screen printed carbon electrode. I did a little demonstration earlier on. The drop size that I used there was actually 50 microliters. We sometimes use 30, but 50 is a good size for us. 50 microliters is actually is about the size of a drop of blood, just to give you some sort of context and size there. And then they're asking me about the minimal concentration of those electrodes. So I will talk about that. Just out of interest, as I sit here now, I realize I'm answering questions and I'm not sharing the screen. As I sit here now, I'm not necessarily sweating. You could argue that I'm perspiring, but the process of water loss through the skin is called the transepidermal water loss tool. I mention that because you can soon Google tool and you actually find out there's a whole science on epidermal water loss. So at any one time, we're actually undergoing this water loss. Now, we lose about half a litre of water per day just through our skin. So I'm just going to do some back of the envelope calculations. I looked it up online as well. So it means we're losing 4 to 9 grams of water per meter squared per hour. Now, meter squared, a large person, you could start arguing they had a meter squared on their back. So that's actually not that much material over quite a large surface area. If I think about this a little bit, realistically, a patch that if you were wearing a wearable sensor, realistically, it may be 1 centimeter squared. So that means that over a 1 centimeter squared area, you may be, through the transepidermal water loss, be losing about 0.5 mgs per centimeter squared per hour. Turn that into liters. So 0.4 milliliters, which is 400 microliters per centimeter squared. I'm just bringing that up actually because don't forget, I was just saying a minute ago that when we're testing on that screen printed electrode, I was using 50 microliters of sample. So theoretically, over a 1 centimeter squared area, you're actually able to pass something like, you'll collect, let's say, 400 microliters per hour. So there's probably enough transepidermal water loss to actually be able to do some sort of passive monitoring. But it's not easy. I think if you were trying to make an application, let's say you're trying to make a lactate application, measuring lactate in sweat by putting a sweat patch on somebody's back is something that we've actually done, and it actually worked quite well. And the reason it worked quite well is because actually athletes, especially professional athletes, they are sweating, and they're probably sweating quite a lot, so it's easy to collect the sample. If you were just trying to measure lactate in somebody that was very sedentary, they're not really sweating, they are undergoing transepidermal water loss, and it's actually quite a slow rate. And you've essentially got to collect what's really atmospheric perspiration, and it's got to be brought or condensed to the liquid phase. So you've actually got to undergo a phase transfer. When somebody's sweating, they're producing sweat, it's already in the liquid form, and you collect it. If they're not sweating, then they're losing that moisture through transepidermal water loss, which is really in the vapor phase. So at which point you have to condense it and then collect it and then detect it. So I think it's actually quite hard to do if you just wanted to measure somebody's, and first of all, it's very hard to actually measure things like lactate in sweat. If somebody's not undergoing anaerobic exercise, then they've probably got not much lactate in them. In this particular case, if you're trying to measure these things like glucose through the transepidermal water loss, I suspect it's a very, very low concentration of signal. So It's probably easier to work on sweat sensors in applications where people are generally sweating. But if you were trying to measure like something in the elderly where they may be not sweating, then the mechanism of actually that moisture coming out of that person's skin is transepidermal water loss. You may, through a 1 centimeter squared area, have about 400 microliters coming out per hour. But though it's coming out in the vapor phase and you have to condense it, and when you've condensed it and you've collected it, then you could potentially pass it over the sensor. But that's not, there's at least a phase transfer there. It doesn't sound that easy. Just out of interest, our glycerol sensors, our glycerol sensors have been tested between 0 micromolar and 400 micromolar. Our glucose sensors, because we're generally working in interstitial fluid or blood glucose, and most people are at 5 millimolar, for example, we actually test in the clinical range in sweat. This is my opinion, let's say, but it's orders of magnitude less. We do have strong signals, so we probably can test orders of magnitude less glucose, but we just haven't done it. At this point, I realize that there's 8 people in the room. This has all been recorded, so don't worry. I'm gonna do a sort of roundup now and just say thank you very much. But we've had 8 questions this morning. You can see that we don't just skip over the questions. We do try to illustrate them with a lot of animation. I know I went early on this, but if you've got any questions, don't worry. You can contact us and we'll bring them up in the next week's webinar. With that, I want to say thank you very much. And for some of you, have a good rest of the day. Okay, thanks so much.